So, mm, so we are over here in the anterior segment, anterior cavity, which is subdivided by the lens and iris, by the iris, under two chambers. And okay, now unlike vitreous tumor, which forms in the embryo and lasts for lifetime. So, can you hear me?
Yes, sir.
Yes.
Fine, absolutely. Uh, uh, Lasts for lifetime. Aqueous humor forms and drains continually, uh, and like lacrimal secretion, right? But it is over the conjunctiva. It is in the exterior part, the surface, uh, but this secretion occurs uh, just behind the cornea.
স্যার স্যার স্লাইডটা দেখা যাচ্ছে না।
Slide দেখতে পাচ্ছ না? Okay.
হ্যাঁ, স্যার।
Okay. So, can you share? Can you see the slide?
Yes, sir. Yes.
Yes, sir.
Okay. So now, what is the function of this secretion? So, okay. Now, how it is formed? Now, it filters from the capillaries of the ciliary processes into the posterior chamber and freely diffuses through the vitreous humor in the posterior segment before returning to the anterior segment. This is important. I would like you to focus on this line. Now, it filters. It means the aqueous humor, right? So aqueous humor forms and drains continually and is in constant motion. Okay, let me show you from where it gets situated. Actually, this lacrimal, this is your ciliary body, and ciliary processes are there. Your finger like projections are there, and from here this secretion occurs, right? And then they enter in this chamber and some fluid moves to this, but most of them actually move ahead and through this pupil, okay, they comes to this anterior part, anterior chamber, and from here it drains off. So this is the circulation. Okay. This is the circulation. Okay. Okay. Now you can clearly see this. Can you see the slide? You see
Yes, sir.
Yes, sir.
where this aqueous humor is being secreted. It is being secreted from the ciliary processes, okay, of a ciliary body, and then it is moving through this chamber and through this pupil. It is coming out to the anterior part, anterior chamber. Then actually this get absorbed through this sclerus venous sinus, okay, and through this sinus it eventually goes to the venous system. So this secretion actually continuously occurring in the system. We cannot realize, but it is also from the upper side also it is continuously secreted and being circulated. Okay, let's go back to the literature. So now I think you will understand the thing in better way So it filters from capillaries of the ciliary processes into the posterior chamber. Okay, why it is posterior chamber? This is the posterior chamber of anterior cavity. So this is the anterior cavity and this is the posterior chamber. This is the anterior chamber, right? And it is continuously being secreted in this posterior chamber, and then it comes into the anterior chamber, and then actually it is being absorbed to the scleral venous sinus. This is also again very interesting structure. This sinus, we'll talk about it later on. Okay. Now, after flowing through the pupil into the anterior chamber, it drains into the venous blood via scleral venous sinus. Yes, right now I have shown you this scleral venous sinus. Canal of Schlemm, it is also called canal of Schlemm. An unusual venous channel that encircles the eye in the angle at the sclera cornea junction. Just hold on, I have to attend one more call. Hello. Okay. So this is also called canal of Schlemm. So this an unusual venous channel that encircles the eye in the angle at the sclera cornea junction. Sclera cornea junction. This angle is called the corneal scleral junction or sclera corneal junction. So you can see the angle, one angle. So normally aqueous humor is produced and drained at the same rate, maintaining a constant intraocular pressure of about 16 millimeter mercury, which helps to support the eyeball internally. Aqueous humor supplies nutrients and oxygen to the lens and cornea and to some cells of the retina, and it carries away the metabolic waste. So this part is very important. I think you have understood the process of secretion, absorption, and their function, the function of the aqueous humor. Okay. Now, coming to glaucoma. If when what is glaucoma and when it occurs? If the drainage of aqueous humor is blocked, fluid backs up like in a clogged sink, right? If this is clogged up, if it is not being drained to the scleral venous sinus, then what will happen? Secretion will continue and pressure will increase in this chamber, right? So this is what. So if the drainage of aqueous humor is blocked, fluid backs up like a clogged sink, and pressure within the eye may increase to dangerous levels and compress the retina and optic nerve. And this pressure, the increased pressure over here, can compress the retinal structure, our neural structure, okay, and eventually it can actually damage the layer, or so impulse may not pass to the optic nerve due to this compression. Okay, if the pressure rise up in this chamber and it compresses the most vulnerable neural layer, actually the retina. So this is actually said over here. So So pressure within the increase to dangerous level and compress the retina and optic nerve, a condition called glaucoma. And this condition is called the eventual result is blindness. And unless the condition is detected early, unfortunately, many forms of glaucoma still sight. We take away the sight so slowly and painlessly that people do not realize they have a problem. Okay, so this glaucoma could actually this drainage process can be clogged due to many reasons. One of the reason could be the inherent because maybe the sinus is not here, so it's a genetic problem. Some people may be born with it, and maybe some infection may clog it. Okay, or any other reasons. If the any blood clot happens over here, it can clog the sinus. So there are various reasons of clogging and this sinus or drainage pathway, and the treatments are also there. Okay, if it is not there, so surgically it can be rectified, and glaucoma can be rectified, but this channels it's not there. And this clog, if something is clogging the channel, it can be washed off. uh, but there are some medications are also that so that the secretion is slowed down. So by medication it can be done so that pressure reduces over here, or in some there's a constriction inducing agents can be induced, so that again blood flow reduces in this region. So there are different ways of treating this, but this is what the glaucoma is actually due to the clogging over here. The pressure rises and which eventually causes the damage to the.
Bài viết cái gì tông hả?
Okay,
Hả?
is it clear?
Ở bài,
Yes, sir.
ở bơi,
Yes, sir.
tao phải không cả.
Okay.
Thân nó ra,
So we have
thân
almost
nó thân nè.
the end of the slide. Then next, there is another point I have to mention: the lens. Our lens is biconvex and transparent and flexible structure that can change shape to allow the vessel. The lens is biconvex and transparent, and cataract. Cataract is actually related with this lens structure. When the lens, this is transparent structure, when this lens becomes opaque, then it is called cataract. Okay, it is not layered over the lens. Lens itself becomes opaque, so light cannot enter through it. So only thing is you need to replace the lens. Now, why cataract happens? Why the lens get damaged? There are many reasons, and this the cataract is clouding of lens that causes the world to appear distorted, as if seen through the frosted glass. Then some cataracts are congenital, but most result from age-related hardening and thickening of the lens, and are a secondary consequence of diabetes mellitus. Okay. So diabetes mellitus, diabetes actually induces this process, and so your blood glucose level should be checked, and heavy smoking, frequent exposure to intense sunlight increase the risk of cataracts. Whereas long-term dietary supplementation with vitamin C appears to significantly decrease the risk. So you can understand the importance of vitamin C regarding this cataract. So you should not have deficiency of vitamin C, which can actually may aggravate it. Now, what about the promoting factor? The direct cause of cataract seems to be inadequate delivery of nutrients to the deeper lens fibers. Now, metabolic changes that uh, 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 promote clumping of the crystalline proteins. So, metabolic changes that result and promote the clumping of the crystalline proteins. This clumping of crystalline proteins actually make it okay. Okay. So fortunately, the offending lens can be surgically removed, and an artificial lens implanted can be implanted to save the patient's sight. So with this, I have come to the end of this, session or class. Thank you all.
স্যার
Yes.
স্যার ক্রিস্টালিন প্রোটিনসটা কি মানে আগে থেকে প্রেজেন্ট থাকে নাকি মানে সিক্রিট হয় নিউ ভাবে?
Just it does get clumped. Okay.
ওকে স্যার।
So আশা করি তোমরা সবাই বুঝেছো. You go through it, and you know this important. Okay, I end over here, right? So thank you all.